fat-melting injections, compounds named the Wolverine peptide, and biohackers online claiming they've basically hacked aging itself. Right now, peptides are absolutely everywhere. Gym influencers injecting mystery compounds, Silicon Valley biohackers spending thousands on longevity stacks. We've got peptides for weight loss, muscle growth, focus, and honestly, some of the science here is genuinely fascinating. So today, we're diving into 5 of the biggest peptides online right now. All right, let's dive right in. What are peptides? The word peptide sounds futuristic and intimidating, but biologically, they're actually pretty simple. Peptides are short chains of amino acids, tiny fragments of protein, and your body already naturally uses them all the time. They help regulate things like hormones, appetite, metabolism. So the idea behind peptide therapy is actually pretty straightforward. If the body already uses these signaling molecules naturally, can we create versions that amplify certain biologic effects? And in some cases, absolutely yes. But online, the peptide world has evolved into this bizarre intersection of medicine, fitness culture, and internet biohacking. And medically, that's where things start getting complicated. Some have strong clinical research and FDA oversight behind them. Others have almost no long-term human safety data whatsoever. And online, those two categories constantly get blended together like they're the same thing when they absolutely are not. Number 5, copper peptides. Let's start with one of the more medically grounded peptide categories out there. If you spend any time on skincare or anti-aging YouTube, you've probably heard people talking about GHK-Cu, also known as the copper peptide. GHK-Cu is a naturally occurring copper binding peptide already found in the human body. Researchers became interested in it because copper plays a role in tissue repair, collagen production, inflammation regulation, and wound healing. The theory behind copper peptides is that they may help signal the skin to repair itself more effectively through collagen signaling and tissue remodeling pathways. Most people encounter copper peptides through topical products like creams, serums, or microneedling routines. But more recently, an injectable version has also started appearing in peptide clinics and anti-aging spaces, and importantly, injectable GHK-Cu is not FDA approved specifically for anti-aging or cosmetic use. The science is interesting. The marketing is just sometimes a little ahead of reality. But overall, from a medical standpoint, copper peptides probably fall much closer to evidence-informed cosmetic science rather than experimental biohacking. Number 4, Melanotan II. Now, we move into one of the stranger corners of the peptide world, also known online as the tanning peptide. So what exactly is this stuff? Melanotan II is a synthetic peptide originally developed to stimulate melanin production in the body. Melanin is the pigment responsible for skin color and tanning response. The original idea was if you could stimulate melanin pathways artificially, maybe you can increase pigmentation while potentially reducing UV-related skin damage. The problem is, those receptors don't only affect skin color, which is why the side effects can get a little weird. We're talking nausea, flushing, fatigue, appetite suppression. Now, one of the biggest reasons dermatologists are cautious about Melanotan II is because it is not FDA approved and long-term human safety data remains limited. And like many online peptides, sourcing and quality control remain major concerns. There have been reports involving rapid darkening of moles, new pigmented lesions, and unusual pigmentation changes after use. Now, to be clear, this does not mean scientists have proven melanotan causes melanoma or skin cancer, but the concern is significant enough that many dermatologists remain very cautious about the compound. Because online, melanotan often gets marketed casually like bronze skin cheat code. Meanwhile, medically, we're talking about an unapproved synthetic peptide that alters pigmentation pathways and still lacks strong long-term human safety data. Number 3, CJC-1295 and Ipamorelin. Now we officially enter the kingdom of gym bro science. CJC-1295 and Ipamorelin are two of the most popular performance and anti-aging peptides online because they're designed to stimulate growth hormone release. And this is where the internet really starts promising superhero level results. So what are they exactly doing? CJC-1295 is a synthetic analog of growth hormone releasing hormone. Ipamorelin works a little different. It acts through the ghrelin receptor pathway, which also stimulates growth hormone release. The biggest questions people ask online are, does it build muscle? Does it burn fat? Is it safe? And medically, the reality is probably somewhere in the middle. There is real endocrine science here, but the evidence for dramatic anti-aging or body transformation effects is still much weaker than the internet makes it sound. There are also real risks to manipulating growth hormone pathways unnecessarily: water retention, bloating, joint pain, headaches, and injection site reactions. The FDA has also specifically flagged CJC-1295 for adverse events involving increased heart rate and vasodilatory reactions. There is legitimate endocrine science behind these compounds, but there's still a huge difference between interesting hormone research and proven anti-aging therapy. From a medical standpoint, CJC-1295 and Ipamorelin fall into a much more cautious category than copper peptides. Number 2, BPC-157. Now we arrive at probably the most famous internet peptide of them all, also known online as the Wolverine peptide. People online claim BPC-157 can accelerate tendon healing, muscle recovery, and injury recovery. And honestly, some of the early animal research actually is intriguing. What exactly is it? BPC stands for Body Protection Compound, and BPC-157 is a synthetic peptide fragment derived from a protein found in gastric juice. Researchers originally became interested in it because of the possible healing-related effects in the gastrointestinal tract. Now, the biggest questions online are usually, does BPC heal injuries? Can it heal the gut? Is it safe? And of course, is it legal? And technically, that answer gets a little weird, because despite all the hype online, BPC-157 is not FDA approved for human use in the United States. It's also banned by the World Anti-Doping Agency. Researchers have looked at possible effects involving blood vessel formation, inflammation regulation, and tissue remodeling. But here's the important medical reality check. Most of this data is still preclinical. We do not currently have large, high-quality, long-term human clinical trials proving BPC-157 safely accelerates healing the way the internet often claims. It's not necessarily fake science. There is legitimate biologic interest in BPC-157, but medically, it still falls much closer to experimental regenerative medicine rather than proven mainstream therapy. Number 1, GLP-1s. And finally, we arrive at the peptide category that has completely reshaped the conversation around obesity, diabetes, appetite regulation, and metabolic health. Ozempic, Wegovy, Mounjaro. At this point, even people who know absolutely nothing about peptides have probably heard at least one of those names. But unlike many of the experimental compounds earlier in this video, these medications have massive amounts of clinical research behind them. GLP-1 stands for glucagon-like peptide 1, which is a hormone your body naturally produces after eating. It helps regulate insulin release, blood sugar control, digestion, and feelings of fullness. Now, medically, this category is very different from some of the underground peptides floating around online. These are FDA-approved medications backed by massive clinical trials showing meaningful effects in obesity treatment, diabetes management, cardiovascular risk reduction, and metabolic health. While these medications can be incredibly effective, they are still powerful drugs with real side effects and risks that require proper medical supervision. Another major issue recently has involved compounded or counterfeit GLP-1 products. Because demand became so high that shortages pushed some people toward compounding pharmacies, medical spas, online sellers, the FDA has issued warnings involving dosing errors, contamination concerns, and hospitalizations associated with improperly compounded GLP-1 products. Are GLP-1s magic? No. Can they be incredibly effective tools for the right patient under proper medical supervision? Absolutely. All right, that was a quick dive into some of the biggest peptides on the internet. If you guys want a part 2 covering the weirdest and most experimental peptides floating around online right now, let me know down in the comments. Don't forget to subscribe, turn on your notifications, and binge watch this playlist right here. Thank you so much for watching, and stay healthy, my friends.